used as the first treatment to prevent miscarriage. The treatment works by increasing the amount of stem cells in the lining of the womb, which improves conditions to support pregnancy.
Well, previous research by University of Warwick researchers revealed a lack of stem cells in the womb lining is causing thousands of women to suffer from recurrent miscarriages. Well, let's go live to Coventry, where we can speak to Professor Jan Brosens, Professor of Obstetrics and Gynecology at Warwick Medical School at the University of Warwick. A very good morning to you, Professor. Could this be the breakthrough that so many women would be hoping for?
Well, we very much hope it's a step towards the generation of a very effective way of preventing large number of miscarriages. So miscarriages, unfortunately, very, very common. Approximately 1 in 4 to 1 in 7 pregnancies will unfortunately end up as a miscarriage. And approximately 5% of women will suffer 2 or more consecutive pregnancy losses. And many of these consecutive pregnancy losses are due to an abnormal lining of the womb that just can't be, which is insufficiently prepared to sustain the pregnancy. So by enhancing the environment where that embryo will find itself in, we believe that we can reduce the number of recurrent miscarriages significantly.
Because there's relatively little known about the causes of miscarriage, and it has been a challenge for many a couple who've been struggling with recurrent miscarriages to try and get to the bottom of what's going wrong. This was a relatively small study, though, just 38 women. What are the hopes now going forward?
So, 2 things. So indeed, for many, many, many years, the medical belief was that early pregnancy is a vulnerable, fragile state. And the concept emerged that a whole heap of diseases and disorders that really don't affect your health outside pregnancy could become catastrophic in pregnancy. So the medical approach for the last 40 or so years has been to test these patients for clotting abnormalities, hormonal imbalances, autoimmune disorders, etc., in the hope that if you find something out of kilter, you can give a little pill and that will be the end of the problem. But actually, over the last 5 years, a very, very different way of looking at miscarriages has emerged. And it's grounded in a much better understanding of what the real challenges are in early pregnancy. And it turns out that at the time of implantation, human embryos are extremely diverse. Some will be genetically completely abnormal. Others will have cells that are genetically abnormal. So much so that no 2 embryos are actually identical around the time of implantation. And it was found that an optimal lining of the womb is capable of dealing with that diversity and should actively reject poor quality embryos while simultaneously create an environment that enables a high quality embryo to thrive and to develop. And that process is driven by specialized cells, the decidual cells. And what we found was that in patients with frequent miscarriages, we have a deficiency in stem cells, which also means that these decidual cells actually became very, very stressed and start producing a whole heap of factors that ultimately lead to breakdown of the lining of the womb in pregnancy. So this entire study was designed and was aimed at testing whether we could pharmacologically use a drug that's already on the market and actually boost the amount of these stem cells, and by doing so, reduce the amount of these stressed out decidual cells. So the size of the study was merely a reflection of the endpoints. Could we do that? And the answer of the study was yes, we can. We can unequivocally increase the amount of stem cells in the lining of the womb, and we can also reduce by 50% the amount of stressed and inflammatory cells. So that was the purpose of the trial. Can we show biological effect? Next step is to do a large clinical trial and see how many miscarriages we can actually prevent.
OK, well, it's relatively cheap if it goes on to be used, just £1 for this drug for diabetes. Professor Jan Brosens, really good to get your thoughts this morning. Thank you.
Thank you very much.